Good afternoon, everybody. I am sure all of you must be keeping good health. I am Sanya, your host from Beautiful Spotless Skin Team. To look beautiful and smart at all times is the quest of humans, and right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is a common skin condition that can impact anyone, whether you are a teenager or an adult. This complaint is no stranger. Knowing the various type of acne can help you to treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. That is QUL. It goes beyond just being a skin element to various psychological disorders such as depression, anxiety, stress, and low self confidence. Hence, it is important to know about the holistic treatment approach for this alignment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this common skin condition and also to be aware of treatment approaches for acne management. So let's connect today with our skin expert, Dr. Madhulika Gavvala from Hyderabad, to talk on acne and acne sequelae. Dr. Madhulika has done her MBBS from Sri B.M. Patil Medical College, Hospital and Research Center, Karnataka, and MDDVL from Mamta Medical College and General Hospital, Telangana. She has also done fellowship in cosmetology and worked with institutes like Apollo Hospital as consultant dermatologist. Currently, she is chief consultant dermatologist and cosmetologist at Dermavista Skin Clinic based at Hyderabad. She also has five original research article publication in index journals. She also attended several dermatology and cosmetology international, national, and state conferences, workshops, and CMEs. She is a member of IADVL and IMA. Dr. Madhulika, welcome, and it's an honor to host you today.
It's an honor being a part of this program by being organized by Beautiful Spotless Skin. So, and a very good afternoon to everybody tuning in to listen to our podcast. Yeah.
Good afternoon, doctor, and good afternoon, everybody. Doctor, as we are going to start talking about acne management, acne, but the very first question I know which occurs to everybody watching this live is what is basically acne? What is acne actually? How can we define it? What is acne?
Okay. Acne, or in general colloquial language, we call it pimples, right? So what is it? It's a chronic, like a self-limiting, but very recurrent kind of problem. It's an inflammatory disorder of the openings of your hair follicle and sebaceous glands. Okay. So that is what basically acne is. And if you ask me why acne occurs, why pimples occur again and again. So there's like a big pathogenesis behind this, the reason why it occurs. So usually the thing that happens is there is usually the blockage of the openings of the sebaceous and the hair follicle openings. Okay, so they are blocked, and there's like increased colonization by bacteria on your face, and then there's also increased sebum production in most cases. And also there's an inflammatory component. Okay, so this is why acne occurs. So acne is pimples, and it's very chronic, recurrent, and self-limiting. Yes.
Okay, so acne are pimples, and usually we avoid, that if one pimple occur, we are like, it's okay, it will go by, itself. But then the
Yes.
problem continues, and
Right.
continuously people get pimples. So, doctor,
Right.
when we talk about pimples, are there any types of, we call acne lesion or what we call pimples? Are there any types of it?
Yes, of course. So there are like when you see each other's faces also, not everybody's pimples look alike, right? So
Yeah.
some are whiteheads and blackheads. Those we call in like in scientific language comedones. Okay. So those are open comedones or closed comedones. Then other than that, you see sometimes red bumps, right? Those are papules, right? And then also you see a lot of pustule lesions. Sometimes they're bigger, smaller. So pustules or nodules. So these are basically the kinds of acne: comedones, papules, pustules, and nodules. Yeah.
Okay, so these are the types of acne, and when we talk about the causes of acne,
Mhm.
usually people are still searching out that yesterday the pimple was not there, and overnight the pimple occur on
Okay.
their faces. So
Okay.
there are any like specific areas of the face acne means specific causes?
Right. So basically, this is two things. One is the causes, and of course, what area of your face is affected. It indicates what is the underlying cause also. So usually, the triggers or causes of is like in females around the menses, you have triggers. Also, when there is like a little bit of hormonal imbalance in the body, that also triggers acne. Okay. So your lifestyle, your eating habits, your stress levels. Okay. So all of these kind of contribute to your acne production, right? So also then this sort of comes to you ask like what are the face areas, right? So if you see acne on the forehead, so that usually indicates whether you have a dandruff or you're wearing lots of hair product and all, which keeps getting on your face, right? If you have it on the cheeks, if you are like used to wearing very oil based cosmetics and all, and if you have somewhere down the chin, this is where hormonal acne usually is. Okay, so if you have issues like PCOS or hyperinsulinemia, hyperandrogenism, you have acne down here, especially in females, right? This is PCOS and all is in female. So this is hormonal acne. And you usually get this acne when you're like a little older, beyond your 25s and all. So that is when you start seeing acne here. So this is hormonal, and this is usually using cosmetics or general acne. Also, this is the commonest side of having it. Forehead is usually common in adolescents and all who have a lot of dandruff and you don't take care of their hair properly. So they have acne here. Right.
Okay, so if you are having acne or pimple on your forehead, that means you're not taking care of your hair hair loss, dandruff problem. Usually we avoid. We don't think that dandruff can cause acne to our face. That is
Right.
like I
Hmm.
think the biggest
Yes.
problem.
Hmm.
And as you
Hmm.
said that
Hmm.
yeah, if it's near the nose or the cheek,
Right.
it is due to
Yes.
the
And
cosmetic.
also people even get it on the chest and back also. Okay. So even that's also part of a hormonal thing, as well as sometimes having dandruff itself, the flakes keep falling on your back, chest. That itself can trigger. Okay. So you can keep that in mind. Yeah.
Okay, so
Yeah.
these are the causes of acne, and
Right.
doctor, when we talk about the treatment, so how much important is to treat the acne as early as possible, because usually when we have some pimple, people apply home remedy or something like that, but sometimes it works and sometimes it gets worsened. So
Right.
what is like how much it is important to treat it as early as possible?
Right. So usually like when yeah. Hello. Am I audible? Yeah.
Yes, yes, yes.
Uh-huh. So whenever like you talk of treating the acne and all, na, so a lot of people tell you use this, use that, and it will go away. Okay, people use toothpaste, multani mitti, and whatnot on their faces, face
Yes.
packs, facials. No, those don't work. Okay, so basically it doesn't. So treating acne early, also properly, is very important. So why not? Because acne is self-limiting. You will be like, okay, I'll keep getting this for a while. So why should I bother and waste my money on it? So because usually acne is associated with sequel. Okay, so it sort of has again and again, if you keep getting it, and if it keeps getting worse every time because you're not attending to it properly, you get acne scars and pigmentation, which you'll have to spend a lot of money to address them in the future, because they don't go away with home remedies and other superficial creams or something. So that again requires a lot of investment from your side. So rather than that, go consult your dermatologist right away when you have like a breakout of acne. Get it treated properly with proper medication, and then you're set for it, and you start of preventing all the complications that arise because of letting your acne stay on too long.
Right. So going to a dermatologist is important as early as possible.
Yes.
Usually, I think you must have also seen in your patient also, that people treated them at home only, and
Correct.
then they come to
Correct.
you that,
Right.
now it's like the condition is very bad. Now help us.
And Yes. Usually, when they choose to come to a dermatologist, it's already like progressed to a certain level. So why not just come to it, because it's hardly a consultation charges you something, instead of using some cream or lotion or serum which is not going to give you the full benefit of it. Go consult a dermatologist and use the proper product for what kind of acne you have. They are more trained. They see people like this daily. Okay, so they know what your skin type is. They know what your other things are, internal issues and all, and they'll give you a proper medication. Okay, so never self medicate. Okay, don't listen to Instagram influencers, social media influencers. Just, yeah, go to your dermatologist and listen to what they have to say. Right.
Yes, so listen to your dermatologist. That is the important thing of acne. And don't treat it, by yourself or apply home remedy, because you might be having some medical issues, and a dermatologist can rightly treat you well. Doctor, when we are talking about acne, are there any grades of acne? That is smaller than no breakouts or
Yeah,
anything.
sure.
What are the grades of?
Right. Right. So usually when we look at patients, we sort of grade them into four grades. Okay. So which basically falls into mild, moderate, severe kind of thing, and very severe. So this usually we grade them based on the kinds of lesions they have. Usually comedones and papules that I was saying before, red bumps and whiteheads, blackheads, these are treatable easier. Okay. So even with just like topical medication, a little bit of mid-level medication, you're able to address it properly. But when patient, when patient kind of has like pusful lesions, or a lot of nodular kind of lesions, those are not something you should be neglecting, because these are the ones that are going to leave you with permanent scars. Okay, so it's sort of these are the grades of acne, and accordingly they have to be addressed. Especially the grade 3 to 4 are much severe, and you should not be treating it by yourself. Okay, that always requires a dermatological intervention. 1 and 2, even that also, like they respond to topical medication, but not just one single serum or something is not going to help you get out of it. Okay, so those are basically the grades of acne.
Okay, so as you said, there are four types of grades
Four
of
types,
acne.
yes.
That is the
Hmm.
moderate, chronic, and the severe one. Usually, people what they do if they have a pimple or acne, they burst it. Uh, so is it right to burst it? Because many people think that कि this is not going, ये जा नहीं रहा है, let's burst it
Hmm.
out,
Okay.
take out all the pus, and
Okay.
feel fresh that the face is now
Right.
fine.
It's actually kind of a human nature. Like you have a bump on your face, you want to pick it now. So because it's like so visible and it's in your face, and you want to
Correct.
like just go at it. But what happens when you do that is sort of you're first of all using dirty hands to go touch them, right? You're introducing infection, you're making it worse. And also if you pop it too hard, squeeze it too hard, too much, okay, that causes more pigmentary problems. Also the inflammation can get increased, so more scarring can occur. Okay, so you have to be I don't think that popping is like a very good idea. So I know majority of the people do it, some people do it more than the others, but avoid popping pimples. Okay, that's my advice. Yeah.
Yes, so don't pop your pimples and next time you get it, because it can make it worse. Doctor, as you told us, there are four grades of acne. So what are the treatment options? Are there any different treatment options for different grades of acne?
Yes, of course there are. So first, when you come to milder acne like comedones and all, usually something like a clindamycin or like an antibacterial preparation, or like comedolitics like benzoyl peroxide, they all work. Okay, so usually we give them alone or in combination depending on the status of the patient. Other than this, other than topical creams, you also have other oral medications. These can be like mid-level and very high-level medications. So anywhere between like anti-inflammatory antibiotics and anti-androgens, and then OC pills, so many of them, retinoids. So these are like a host of different medicines that are available within a dermatologist's armamentarium, to address acne. So we usually, it's not like one shoe fits all. We sort of decide this seeing multiple things: the patient's internal issues, the how the patient's acne are looking up, how the patient's skin type is, whether they'll be able to take the medications, if there are any other internal issues that might conflict with the kind of medications that we are giving. So this is like a very big nexus of things that goes on behind the doctor putting it on your prescription. So that is the reason I say that don't self-medicate, na? Because you do not understand the entire aspect of it, and you might take the wrong medication. Okay, so these are the different medications medications available for treating different levels of acne. Usually like more severe kind of variants, they need oral medication. Okay, so for that usually we do like a little bit of pre-testing and all, and before we decide whether you're fit to take those medications and all. Okay.
Right. So consulting a dermatologist is must. What I can say that the grades of acne can be treated according to your health. What
Mhm.
health condition are you taking a
Yeah.
lot of stress or everything? You have to tell your dermatologist that this is
Yes.
something. This is the problem.
Yes.
And doctor, is it like that? Any dietary plan? Somebody eat a lot of junk food or food
Right.
outside. Does it
Mhm.
also like help in the acne to come up very easily?
Yes. So acne and diet definitely have a good correlation between them. So when you take foods that have high glycemic index, okay, so which usually increase your blood sugar levels and all, anything with more sugar content, dairy products, of course, like milk, cheese, butter, cream, okay. So also fruits which have like lots of sugar content, mangoes, watermelons, etc. So those kinds of things can like play around with your sugar levels also, alter your insulin kind of levels also, and they in turn increase the cause a hormonal imbalance basically, and that will contribute to your acne production. So it's like a very big process that goes on for you to see the pimple after you eat a lot of cakes and pizzas and everything. But definitely eating junk food results in acne. Okay, so just cut down. If you do have acne, the first thing you should need to change in your lifestyle is your diet. That definitely contributes.
Okay, so cut down your junk food, because if you're having acne, junk food can cause it, like making it worse and worse.
Yes.
And doctor, sometimes people have acne which is painful. It pains. So are there any different type of acne for different skin type, like sensitive skin or dry skin, or the people having oily skin?
You mean to say the medication, you say like the
Yes,
differences
for the
in.
different skin. Is it like that?
Ha,
That
ha.
for
Yeah.
different skin there are different medications available.
Right, right. So what you were asking first is whether how painful kind of pimples. Now, those are usually grade 3 and grade 4 acne, where you have the pus buildup because there's a lot of inflammatory component going on. Na? So that's why you feel the pain. That is why in those people we give like oral medications along with the topical creams and everything that they are using. Okay, so that is for the pain part of it. That's like a very, if you are feeling your acne are very painful, it means you have like a very severe grade of acne. Okay, so the next thing is whether the creams and everything that we use differs according to your skin type. Yes. So usually patients are concerned, what is my skin type? Look at my skin and tell me, doc, what is my skin type, right? So usually if you have like a really, after washing your face in an hour or 2 hours, your face kind of is covered in a layer of oil. So yours is an oily skin. Okay. But if your skin is like dry here and oily here on the T zone where the sebum production is more. So that's a combination skin type where you have like both things. And if you have like completely after washing your face, your skin feels like it needs water, right? It needs hydration. So your skin is dry and a little more sensitive to products that you're using. So choosing a product according to skin type is of utmost importance, because using the wrong product can result in other skin issues popping up. Okay, especially dry and sensitive skin type. They don't tolerate like the harsher acne medications, acne face washes, like say a salicylic or glyco-based face wash is not good for dry sensitive skins. Okay, even combination skins also sometimes don't. Okay, so it's very important to choose which kind of product. So now there's like it's a $1 billion industry, right? Skincare product, and we don't know what to choose. So basically look for what is your skin type first and then choose the product accordingly. Of course, like I keep reiterating again and again, dermatologists will take a look at your face. They know that what is your face type and everything and give you the proper medication. So basically salicylic glyco acid bases, dry and sensitive skins don't use it. Okay, so but if you are like an oily kind of skin, yes, salicylic glyco, these kinds of things are like good in removing the face oils and also that is, yeah.
Right. So before using any product on your skin, you should consult a dermatologist. And sometimes doctor people also don't know what skin type they have,
Mm-hmm.
oily or dry or anything, and they apply.
Mm-hmm.
If some
Yes.
some of my friends suggested me, that this
Mm-hmm.
has
Mm-hmm.
good for me, so they will
Yes.
definitely apply it.
Correct. So see, like it's usually don't believe in magic potions. Now, no one thing can make your acne go away. It's not possible realistically. So even you also know that at the back of your mind. So just advertising and all, don't go by it. Okay. So just be conscious of what you put on the skin, because for the first 1 week you're going to be fine. But after that, you keep using things that are very harsh for your skin type and all, you're going to have issues like land up with allergic contact dermatitis, or irritant contact dermatitis, so many issues. Okay, so better be safe than sorry, right? Yeah.
Right, doctor. And sometimes people also say, we have big nails, so nails can also cause acne. Is it true that the big nails or nails can cause acne because people
You
touch
mean to say
their
nails? Huh.
nails? Yes.
Nails. Acha. Okay. So yeah, definitely one thing is, if you have acne on your face, you have an acne prone skin, do not touch your face with your hands, because you're using these throughout the day. You're touching all the surfaces, you're accumulating the dirt on them, and then you go and frequently touch your face. That sort of, transfers all the dust onto your face. Already when you have acne, you have like increased bacterial colonization on your face as it is, and you do not want to transfer even more dirt, etc., onto your face and like worsen the condition, right? So do not touch or pick your skin when you have acne.
Yes. So next time, be careful whenever you are touching your skin, especially your face. Try not to touch it when your hands are dirty, because as doctor told, acne, the bacteria can cause acne on your skin. Doctor, when we are talking about acne, the types of acne, we also discussed about it treatment. Are there any further complications which are related to acne?
Okay, so basically, acne is two main sequel of it that we want to discuss. One is pigmentation, one is scars. Okay, pigmentation, usually even if you pick or don't pick, there's always a chance that your acne is going to leave a spot. Okay, but it is not permanent. Usually pigmentation lightens with time, and of course some creams and everything can help hasten the process. So other than this, the scars is the more problematic one, because it's lifelong. Once you have an acne scar, it's lifelong, and to get rid of it, you'll have to need to go through a variety of procedures like laser treatments and all. So it doesn't simply go away with just rubbing some creams into. Acne scars don't go because they're quite deep into the skin. Okay, so what do we do to address these acne scars is we go with laser treatments, which can be like ablative lasers, non-ablative lasers. You might have heard of CO2 laser, MNRF. Okay, so these are all like they try to smoothen your skin out and help boost the collagen production and try to remodel your scars. Okay, and several other like cosmetosurgical procedures are there, where you sort of subcision and then grafting and everything is available. This all is like addressing the acne scars. So the best thing is prevention, of course, but if you do have acne scar, treatment options are available. Okay, it's not something like completely out of hand. Yeah.
Right. So do not treat it by yourself. Go to a dermatologist. As doctor said, there are many treatments available, because doctor, people are more scared of the scars coming from the acne, not the acne
Yes.
itself, but
Yes.
they might have come to you that doctor,
Hmm.
ये दाग नहीं
Hmm.
रहना चाहिए चेहरे पे. It will
Right.
look
Right.
bad. And I
So,
think
yeah, because like I told you, the scars and pigmentation are two big problems. Pigmentation, it usually sort of fades, but scars don't. Okay, so that's why if your pimple is like going a little bigger than usual, so you should make sure that it's treated as soon as possible, because you let it stew like that and it sort of builds up to its maximum, and then it goes down very slowly, and then it leaves a scar behind because of the severe inflammatory process that has happened there. Okay, so it hardly takes like what would have happened in 1,000 rupees is now going to cost you somewhere in lakhs, okay, to get rid of. So prevention, of course, is better than cure. Sorry, prevention is better than cure. Yes, of course.
definitely, prevention is better than cure. So,
Mm.
before treating your acne by yourself, please prevent it from coming up. And doctor, many times people go for such some facials, and the products actually
Mm.
they react on their faces. So how somebody can choose that this particular facial or this particular thing they are allergic to, or this cannot cause any harm to the
Okay.
face.
Okay, so basically, when you talk of facials, I'm assuming it's like the beauty parlor facials and face
You're
wash
right.
and everything that you get done. So, usually, my advice, don't go for facials if you have acne prone skin. At least if you have active acne where you keep getting like frequent breakouts of acne, facials are not really good. You feel like whenever there's a facial, you have your skin clean, everything is cleaned out. No, you're just opening your pores up, further dirt is going to settle in, and it's sort of, and even the product itself might not be really up to the standard, and sort of it itself can aggravate the problem. So facials are not really a great option if you have acne prone skin. If you have like a clean smooth skin and you just want to get a facial to relax and all and a little rejuvenated, that's okay. But for acne prone skin, facials are, I would say, a big no. Okay, medifacials, that depends on what kind of treatment you're getting, like a doctor administered facials, now we call it na medifacials and all that. Also in active stage of acne, majority of us dermatologists don't suggest them. Okay, something like a chemical peel, these are a better option. Anti-acne peels and all are a better option than just going for facials, which will cost you just as much but won't be as effective in controlling your acne.
Right, right. So, before going for something like this, you should be careful as we are discussing about acne management. So, doctor, we also have a live viewers question now.
Sure.
There is a viewer, Purvi Mehra, and
Huh.
asking, how often should I follow up with you for acne treatment progress and adjustments?
Okay, that's a very good question. See, usually what people do is they go to a dermatologist once, they've given the creams, and they try to like just keep doing the same thing. Sometimes over medicating yourself is also not good, especially with oral medications which carry long term implications. You should not over medicate. Okay, creams are generally safer. And then I would say something at least once a month if your acne breakout is like very furious, once in 2 to 4 weeks is like ideal. So, but if your acne has settled down at least once in 3 months, you should just go back to your dermat, just have your skin checked, and then see if there's a need for your products that you're using, any change in that is required. So, once in 3 months, if your acne is not very active, and once a month or once in 2 weeks, if the acne is very active. Yeah.
Okay, so you said right that sometimes people don't follow up. They just think that the acne is fine now. You don't have to
Hmm.
go to a dermatologist, concern to a
Right.
dermatologist. That is absolutely right. Doctor, our next viewer, Kiara Chauhan, is here asking
Mm-hmm.
which acne treatment is suitable for my specific skin type. I have oily skin.
So you mean to say the kind of products? Is that she
Uh,
is asking, or just treatments like?
I think she's asking the acne treatment which are available for
Acha.
particular skin
For
type that is
oily. So
oily.
basically, I'm assuming that she has a oily skin and that she has lots of acne. So
Right.
along with like using oral medication, depending on how severe the grade of acne is, and then using the proper creams, I would suggest like anti-acne peels. Okay, so chemical peels are a really good option to achieve that kind of oil control on your face. So with repeated chemical peeling sessions once in 2 weeks or 4 weeks, which are doctor administered. Of course, don't go for self-medicated peels. You might end up burning your face and all. So chemical peels is a good option for her because she has oily skin. Now, once in a month, if she goes for a chemical peel sessions, over the course of time, she'll have a more like balanced skin. Okay, because the sebum production sort of reduces with each passing session of the peel. Yeah.
Okay. So, Kiara, as the doctor said, go for this particular treatment. Doctor, there are more like viewer questions because our
Okay.
viewers are, participating very nicely in this session. Rahul is there and he's asking, are there any differences in acne treatments for adults compared to teenagers?
Okay, so adults and teenagers, yes, of course, because usually when you are in your teenage, we do not like go for very, very high medication right away, okay, because it's usually hormonal, it sort of settles down. If you have like a very severe, we might put you on a retinoid and all. So, but nothing like that alters your hormonal things and all. But if usually when you're sort of crossing your 25s and 30s and your acne is still popping up, especially this happens in females rather than in males, I've observed. So in those patients, sort of there is definitely the kind of difference in medication that we do give because there a hormonal issue exists. Okay, so we need to combat that for this acne to go down. Okay, so definitely there's a change in the treatment, but usually the creams and all they sort of remain the same for both. Yeah.
Okay, so there is a basic difference for the
Difference, yes.
adults and teenagers.
Mm.
We were talking about acne and the treatment
Mm.
and results. And Ginni
Mm.
Sharma is there, and she's asking how long does it typically take for acne treatment to show results?
Acha, okay, that's a very good question because lots of people, they use for a week, they use for 2 weeks, and they get so frustrated that no, this is not going down. So no, it will not go down in a week or two, okay? Because it's been there for a while, it's happening because of internal issue. It takes, if the medication takes time to act, okay? Usually this may take anywhere between a month or 2 months, okay? Depending on how severe your acne is and if you have any internal issues, okay? So just wait, have patience, trust your dermat, and at least wait for 4 weeks before you like give up that it's not working. Okay, minimum 4 weeks. Yes.
Yes. So Ginni Sharma, don't give up, very quickly. Just wait for 4 weeks. As doctor said, it takes time because already your acne is on your face. So it will definitely take some time. Doctor, our viewer Deepak Saxena is here and he's asking, can hormonal changes or imbalance contribute to acne breakouts?
Yes, that's also a very good question. This does happen. Usually in females, the hormonal issue, the factor is more pronounced because males do have testosterone, and because of that increased testosterone in their teenage, they do get acne. Very, very rarely that continues into their late 20s and 30s. Very rarely. Okay. But in females, lots of times they have PCOD issues, okay, or hyperandrogenism, hyperinsulinemia. So this sort of all contributes to the acne production. And like I was saying in the beginning of the talk, na, so that here hormonal acne happens for females, okay? So because of that is the thing is it does happen. Hormones does play a very, very crucial pivotal role in causing acne, especially when you're developing it in later of your 20s and 30s time. So you're checking your hormonal profile also becomes important at this time, okay? If you go consult your dermatologist, they will tell you, okay, that maybe this is a hormonal issue and we need to further evaluate it with blood tests and all. So that the blood tests are needed at that stage, okay? Usually in teenagers we don't do blood tests and all because it's common, okay? We know there is hormonal fluctuation in these people, but at your late 20s and 30s, maybe if you keep getting those acne, pesky acne again and again, then of course you'll need to be further evaluated for PCOD or hyperandrogenism, hyperinsulinemia that might be causing this issue.
Right.
Yeah.
So, as doctor said, hormonal changes or imbalance can definitely contribute to your acne breakouts. Doctor, there is a viewer, Kalpana, asking, can I continue using the same acne treatments I used in my teenage years, or I do need like a different options now?
Okay, so this answering this is a little tricky because when she was a teenager, her skin was a little different, and the cause for the acne might have been different. I'm assuming this is like maybe 10 years or 15 years later that she's asking the questions. So when you are a teenager, usually milder medications work. Okay, so you just like treat it with milder medication that goes off. Okay, so because your hormones at one time it's up, it's down. So, but it usually normalizes. But once you're at your adult stage, like I was saying, there must be an underlying issue. So just applying a cream, you can try and see. Okay, you can apply the same creams and try and see if they are showing the effect, if it's the same kind of acne. But if it's not, like beyond 2 3 weeks, also it's continuing to come again and again, the breakouts are there. So you just need to like get your hormonal evaluation and everything. So just go see your doctor. That would be my advice. Yeah.
Okay, doctor. And
Mm.
I have a question here that
Yeah.
do like, our skin changes from teenage to adult? Is it like that? That teenage skin might be like.
Of course, like it does change. Like usually, the sebum production is much more in your teenage years, okay? Because suddenly you've gone through puberty and your hormones have all suddenly raised up. So you suddenly have a burst of acne on your face, but your hormones will normalize over the time, okay? They should normally, unless you have some hormonal issue, they normalize, okay? So at that time, when the hormones are like very much haywire, at that time you kind of have a lot of oily skin, and you see like once you were a teenager you used to have severe breakout, you have dandruff also, though that also sort of bothers lots of teenagers, not dandruff, and that keeps falling on your face and you get comedonal acne on your forehead. So yes, the skin is definitely different at different stage. Every decade your skin is different, the needs of your skin are different, and of course the treatment also differs. Okay. Yeah.
Yes. So we should know that, what our skin needs at what particular age.
Yes. Yes.
Okay,
Yeah.
doctor. So now we have our next viewer question, that are there any
Mhm.
potential side effects or risk associated with acne treatment?
Okay, acne treatment, usually the topical medications that you use, majority of the antibacterials and comedolitics are safer, but some higher creams and all, which are more potent, so they might cause a little bit of redness, irritation, itching, sort of, because if you don't use it properly. Okay, so you need to, using the medication properly is of utmost importance, especially when you use your face care products and everything. So using it, like having a layer of moisturizer on before you apply your retinoid cream, is very important. Okay, something just like off the top of my head. So you should take care that you're using it the proper way. Otherwise, you're going to land up with the side effect of the medication, which can be extreme dryness, right? Redness, itching. This is with the creams. Oral tablets, of course, you should not, like I told you, over medicate. As long as the dose is proper and they're being given for the enough duration, it's fine. Okay, but higher medications of acne, you need to regularly follow up with your doctor before you continue the course. Okay, because they need to regularly evaluate your blood level. Say if I'm giving you a oral retinoid, I sort of want to evaluate your lipid profile, because cholesterol imbalances happen. Okay, if you're like taking like antibacterial medications for a long while, I want to check whether your renal and liver status is okay. Okay, so your oral part of medications, leave it to the doctor to evaluate whether you're having any side effects or something. So because they need to routinely kind of follow you up. Okay, but your topical medications, you can avoid the side effect by using it the recommended amount in for the recommended amount of time. Okay, and then using it with the proper precautions. Usually less is more. Just because you feel like you have it and you'll apply a lot of it, it'll make a lot of difference. No. Okay, usually for most of the products we suggest a pea-sized quantity, that is more than enough. Okay, so don't overuse the product on your face. You are going to land up with complications.
Definitely. So use your
Right.
products or the treatment as prescribed by the doctor. Do
Right.
not medicate meditate yourself. That is the
Right.
important thing. Doctor, when
Right.
we were talking about the acne, and we have discussed that due to hormonal changes,
Hmm.
acne can
Hmm.
definitely break down.
Hmm.
There's a question from Akansha, that can stress and hormonal changes during this stage of life affect acne?
Yes, of course it does. Stress is like one of the major lifestyle changes that you need to do when you want to like control your acne. Diet is one, stress is another. Because when you are stressed out, when you do not have enough sleep, okay, you don't get your 7 to 8 hours of sleep a day, there's more cortisol production in the body. When there's more cortisol production, again, a little of hormones start going haywire, and because of that, you start developing breakouts. Whenever you are more stressed out, you always it pops up now. So always like try to reduce the stress. If it's like you're chronically in a stress and your breakouts are happening very frequently, maybe you need to look into like modifying your lifestyle, increasing your sleep hours, okay, and reducing your screen time. Okay, so these all sort of play into reduction of stress and all. Yeah.
Yes, so don't stress out. Sometimes, doctor, people stress out because if they have a minute pimple, they stress out that this what is
I know.
happening.
I
That
know.
can also like a stress over stress.
Yes,
That
it's basically a cycle. Okay, so you're stressed, you get acne. Because if you have acne, you get stressed. Okay, so it's like a never-ending cycle. So you have to break the cycle. Yeah.
Yes, so do not take stress as suggested by your doctor. And doctor, here is Shania Sen asking, are there any particular skincare products or ingredients that I should be using in my 30s to manage acne and address signs of aging?
Okay, so see, like I told you, it depends on the skin type. The product you choose always depends on your skin type. If you have like an oily skin type, definitely something like a foam-based cleanser or a gel-based cleanser, which also has a little bit of salicylic or a glycolic in it, which to take off the extra oil. That's good. Okay, but if you have like a combination skin, you need to go with more like gel-based cleanser, which are like a little dialed down and don't have too much of salicylic glyco content, because while it cleans up this area, it dries out this area. Okay, so and that is the thing with combination skin types. And then you have like the dry sensitive skin types, which are like very difficult to manage. For them, I would say use something like a gentle skin cleanser which does not have salicylic or glyco. Okay, so base, this is for face washes, of course. And regarding regarding the face serums, if you have to use it, I wouldn't say face serums are quite very effective in reducing like more grades of acne. But if it's like a very mild pop out once in a while, maybe a niacinamide or a salicylic based serum, which is like in the proper concentration and like a good product, okay, and you're using it the proper way, then that might help. Okay. But sensitive skin types, I would say just stay away from salicylic acid serums and all. They don't usually tolerate it well, especially vitamin C and all. They get sensitive to it, and vitamin C usually doesn't help much, okay, with acne. So it's more niacinamide, which sort of is more helpful in acne prone skin. Right.
Okay. And as you said, that facing, like washing your face with a proper face wash is also important. So it's a question that how many times a day should someone who have acne should wash
Hmm.
their face?
Okay, regardless of whether you have acne or don't have acne, not more than 2 times a day. Once in the morning, once in the evening, once you're done with your work and you've removed all your makeup and everything. Okay, twice a day is more than enough. And especially if you're like, if you want to wash it more frequently, use like a gentler, face wash. If you feel like you have like a lot of oil on your face that's built up and you need to go more than 2 times a day for your face wash, then in between, like 2 times a day, you can go for a little harsher face wash. But in between times, if you do have to use it, use something gentler, okay, which doesn't dry out your skin, okay, so that you can keep note of. So I think other than that, 2 times is the limit of the face wash. Yes.
Okay, so 2 times is the good, I think, the
Huh.
good amount
Right,
to wash
right,
your face. So wash your
right.
face 2 times.
Hmm.
Doctor, there is our viewer, Sunita,
Hmm.
asking
Hmm.
how can I create a long-term skincare routine to manage
Hmm.
acne and prevent future breakouts while
Right.
addressing aging concern?
Okay. So now I'm assuming she's like 30s, na, in her late 30s or something. So she now wants, but she still gets breakout. It means like there must be a hormonal issue under play. Okay. You might not still have PCOD, but still maybe there's a little bit of hyperinsulinemia that's sort of contributing to your acne. So unless your internal issue is addressed, no matter what you put on the skin, it is not going to work. Okay. So, but assuming that you have everything under control and that you're taking proper medication and everything to manage it, so over the long term, like your doctor usually prescribes you like prescription grade medicines, na? So once you're done, I'm pretty sure they'll give you like a maintenance medicine. Okay, so after, even after you're done, after that, okay, you want some serums or something, niacinamide, like I told you, is a good option. Okay, so over the course, if you want to include something, niacinamide. Retinol based serums are a little here and there because not everybody tolerates retinol very well, and it depends on the percentage, the product that they are using also. So since she's talking about anti-aging as well, retinoids are helpful with acne as well, but it depends basically on what molecule you're using and whether it is like you have a lot of dry sensitive skin. Retinol usually does not well tolerated, okay, or you have to gradually build your tolerance up to it. Okay, so usually how do you go about like introducing retinol into is, you start off small, you have like a less contact time, gradually increase your contact time rather than just going applying it on the first day itself overnight all over the face. No, you're not going to tolerate it because you have a sensitive skin. Okay, so just be wary of that, what product you are using. Like I told you, your dermatologist is the best person with to decide whether you are a fit candidate to use all these serums and not. Okay, yeah.
Okay.
Yeah,
And
right.
ma'am, any lifestyle changes that you suggest to all our viewers watching this live for acne management?
Yes. Yes, acne is not just something that is going to be cured by your dermatologist writing a few medications on the prescription. Okay, it needs to, have some changes from your core. Okay, your lifestyle needs to change. Of course, it's contributing to your acne. One is reduction of stress. One is the change in diet I was talking about. Cutting down all the junk and unhealthy food from your this thing, sugars and everything you want to control, and increasing physical activity is the utmost importance because we are so much used to a sedentary lifestyle. No matter how much you diet, whatever little food you take, that needs to be metabolized by your system, right? So unless there is activity in your body, your system is not going to metabolize all these things. Okay, so activity, physical activity per day, at least I would say If you can't do anything else, do brisk walking. Okay, that is like in your thing that doesn't need a lot of investment. It just needs your two legs and your willingness to do physical activity. Do it for 15-30 minutes at least. You start off slow and build up, on that. You can go for yoga or some other aerobics, whatever your body permits. Okay, but at least start with something. Okay, from today you can start with like doing brisk walking if you did not do physical activity. Yeah,
Definitely, and I'm sure they will definitely start or any physical activity, and start eating healthy.
right.
It was quite a very, very, very amazing session. And before
Yes.
we end this session, any takeaway message for all our viewers? Any closing remark for all our viewers?
Sure. So basically, like I was saying, acne is not just something that goes away with a dermatologist's prescription. It needs work from their side. It needs work from your side. Okay. So change your lifestyle, follow your dermatologist's advice, keep following back. Okay. Don't give up. So these are the basic takeaways of your acne session. Okay. Right.
Yes, so don't give up, and please do not self-medicate. Go
Yes.
refer a dermatologist if you are having
Yes.
acne. Thank you so much, Dr. Madhulika, for your valuable time.
Yeah. Thank you so much for hosting. It was a great session.
Thank
Yeah.
you. Thank you so much, Doctor.
Thank you.
And it has been a
Yes.
very informative session for all of viewers. And it is
Yes.
really great to hear you. And
Yeah.
we really look forward for many such sessions in the coming
Sure.
time as well.
Surely. Surely. Thank you so much for inviting me. Thank you.
Thank you. Thank you so much,
Thank
Doctor.
you.
And thank you so
Yeah.
much to all our viewers for an excellent participation in today's session. And stay connected to our beautiful Spotless Skin page. Bye bye and keep glowing.